Here are the 6 most expensive medical procedures and treatments in the United States in 2024 from Resolve Medical Bills, a private online expert medical billing service. Heart transplant, which costs about $1.3 million, is an operation in which a failing heart is replaced with a healthy donor heart. A heart transplant team is composed of highly trained and skilled medical professionals. You will have to wait for a healthy donor heart, and it must be transplanted within a few hours. The second most expensive surgery in the country is a liver transplant, at a cost of about $1.1 million. A liver transplant requires complex testing and assessment to determine your eligibility, and also requires a highly specialized team. If you have acute or chronic liver failure, you may be placed on the United Network for Organs waiting list, ranked by severity of need. At an approximate cost of $950,000, the third most costly medical procedure in the United States is a bone marrow transplant or stem cell transplant to treat blood and lymphatic system cancers, blood disorders like sickle cell anemia, and autoimmune diseases like multiple sclerosis. A bone marrow transplant team is highly specialized. Patients receive high doses of chemotherapy or radiation to destroy diseased bone marrow. Then healthy stem cells are infused into the bloodstream, which travel to the bone marrow and produce new blood cells. Double lung transplant, costing around $850,000, involves removing both diseased lungs and replacing them with donor lungs. The procedure requires a specially trained team. Due to a shortage of donors, the wait can be 3 months to a couple of years. Recovery takes at least 3 months and requires lifelong management. Intestinal or small bowel transplant, costing approximately $750,000 without insurance, is the replacement of a diseased or malfunctioning small intestine with a healthy one from a deceased donor. This rare, complex procedure is for patients with intestinal failure who can't absorb enough nutrients or fluids. The surgery requires a highly skilled team and lifelong monitoring. A pancreas transplant costs approximately $600,000, making it the 6th most expensive medical procedure. It's the only treatment that may be a cure for type 1 diabetes. Your new pancreas will create the insulin, and you will no longer have to take injections for it. So there you have it, the top 6 most expensive medical procedures available. If you are a self-funded employer, put these potential procedures on your radar and begin to budget for them. Contact us at finHealth for assistance in analyzing your medical claims data. We have saved our self-funded employer clients millions by identifying fraud, waste, and abuse. Visit finhealth.com to find out more or to ask for a demo. Our email is sales@finhealth.com.